weekend.
Yeah, in the meantime, though, we do have to live with the smoky air, and it's creating real health concerns.
Yeah, here to talk more about that is Dr. Michael Niederman, a pulmonologist at NY-Presbyterian Weill Cornell Medical Center. Doctor, thank you so much for joining us. So already, we're feeling the burning eyes sensation, coughing. What are some of the health effects from the smoke?
We're hoping that the health effects are temporary and not long-term, but many people are going to experience symptoms, as you talked about, of chest tightness, wheezing, shortness of breath, coughing, and these can be particularly concerning for individuals with underlying heart disease, lung disease. It's been a real problem for our patients with asthma, emphysema, pulmonary fibrosis, and the other concern is that for some people, the inhalation of these pollutants not only penetrates into the bronchial tubes, but deeper in the lung. Some of those materials carry toxic, noxious fumes with them that can enter the bloodstream and potentially be harmful. But the much more common concern is that these particulate matters interfere with the clearance of inhaled pathogens from the lung, and some people may get infections, particularly viral infections, bronchitis, or rarely even pneumonia. So all of those are concerns. And although generally the people most at risk are those with chronic diseases, even previously healthy individuals may be particularly sensitive to the effects of this inhalation of pollutants.
Walk us through masks and how effective they are at keeping your lungs clear.
Well, masks are very important because masks filter out the smallest particles, and those are the ones that can penetrate deeper into the lung and cause some of the most harm. So a mask can be very important, but there are some caveats. The N95 that you mentioned, or the KN95, filter out most of the particles, and only the smallest particles get through. There are other particulate respirators that are close to 100% filtration. The problem with all of these is, to be fully effective, you've got to wear it right. You've got to have a good seal, and you've got to be able to function with the mask on. Some people have difficulty being outdoors, doing exercise, doing their strenuous physical activities with a mask on, harder to breathe through. So it's a delicate balance, and that's why anybody who's really experiencing symptoms outdoors and should be wearing a mask. But if you're experiencing outdoor symptoms, you want to get indoors as quickly as possible. You want to keep the windows closed. You want to be in central air conditioning if it's available. If not, you want to have a air filter in your home. You'd like to have a better filter put onto your air conditioning unit if that's available. But doing anything to minimize the exposure to this high level of air pollution with particulate matter.
Yeah, stay inside as much as you can. All right, doctor, appreciate you coming on the show and telling us a little bit about the health risks that we could face.